So essentially, this massive piece of legislation, it's multi-trillion dollars, and it is the basis of Trump's legislative agenda. It essentially enshrines his 2017 tax credit or tax cuts, the giant package from his first term, but also has lots of other goodies in there, as well as significant cuts to programs like Medicaid and food stamps. So right now, we are kind of in this extremely messy process of trying to get it through. It's already passed the House. Now the Senate is considering its own version and trying to get it through the Senate on the backs of only Republican support, which has proven to be very difficult. And the president wants it on his desk by July 4th, but it's unclear right now whether that will actually happen.
Megan, what's the latest with President Trump's relationship with Congress? What are the odds of this potentially making it through?
So right now it is, I would say, likely to get through at some point, but they really need to finalize a lot of these various provisions. The Senate parliamentarian, essentially the chief rules keeper in the chamber, is going through the bill to make sure it adheres to these really strict standards for them passing it only on the backs of Republican support. So basically in a way that makes it immune to a Democratic filibuster. That's where the hangup is right now. And we got a ruling this morning on Medicaid that essentially takes most of the provisions anyway, on Medicaid in the Senate bill, these cost-cutting provisions, and said it does not adhere to these rules and they need to be struck. So now Republicans need to find another way to save $250 billion in this bill. So it is, we're, kind of in the heat of the negotiations at this moment in the Senate, while also trying to appeal to, state and local tax deduction folks in the House, New Yorkers and New Jersey representatives, those from Southern California. So they're trying to thread a lot of needles at this moment. I think it eventually does get done, but perhaps not on the president's time frame.
So you mentioned this $250 billion in Medicaid and other health care spending that's being debated here today. How much of a roadblock is that for the Republican efforts here?
So it's interesting. It makes it easier to pass among some moderate Republicans, people like Senator Susan Collins, who have been concerned about the Medicaid cuts. So taking those out of the bill, particularly language that would harm rural hospitals, would help gain votes among a certain set of senators and would even help ease its passage among a certain set of lawmakers in the House. But it causes problems with fiscal hawks in both chambers who say that the bill costs too much money and doesn't save enough. So when you create this $250 billion hole, essentially you're creating a problem elsewhere in the Republican Party.
Megan, what's the most ambitious part of this bill? What's the sticking point here that you really need to get Democrat support from?
So this bill will pass without any Democratic support. It is much like Joe Biden's Inflation Reduction Act from 3 years ago. And that's why it needs to adhere to these really strict rules so it can pass the Senate on a 50-vote threshold as opposed to the 60 vote that most legislation requires. So this is really about infighting within the Republican Party and really corralling the various wings of the party. You have people who are concerned about repealing the clean energy tax credits that were passed during the Biden era. So you have moderates who are concerned about that. Then you have the fiscal hawks worried about it costing too much. So this is really kind of an intra-family negotiation for Republicans.